Hello. So I hope whoever is watching this video is doing well and is in good health. So if you're looking for a video to know how to prepare for the MRCEM Primary, you've come to the right place. So I recently sat my MRCEM Primary in October 2024, and I'm happy to share that I passed the exam, and not only did I pass, I scored really well in the exam. So I just wanted to give a brief review of my experience and how I prepared. So it might help you, it might not help you. So I'm just gonna uh, give out my review. So we're going to start with the preparation time. If you're planning to take this exam without a job, I think somewhere between 1.5 to 2 months is enough for this exam. If you're someone who's planning to take this exam with a job, I think this in between 3 to 4 months is a good time. Now, this time period that I've set, this really depends upon how many years has it been since you've graduated. Like when I sat for this exam, it's been like 2 years. So it's not such a big time in between my MBBS and this exam, since it's going to test a lot of clinicals based on basic sciences, right? So it can vary from how long has it been for you since you last touched the basic sciences, right? So pre-preparation. So I always tell a lot of people, whoever asks me regarding any exam, I tell them at least, and I repeat, at least talk to 10 people who've given this exam. Why? Because it's really important for you to know what sort of experience these people had, what resources did they use, and what challenges did they came across. Because if I'm facing a challenge, it's not necessary that you'll face the same challenge. So this really helps you build up some form of base, some form of knowledge regarding as to what to expect from this exam, how to prepare, and how to really deliver your level best in this exam. So please do talk to 10 people, reach out to people on social media platforms, reach out to your seniors, and before sitting the exam, do talk to at least 10 candidates. I talked to around 20 to 25 people, and that's how I concluded how I'm going to prepare for the exam. So at least talk to 10 people, right? So moving on, how to study. So like I said, I talked to like 20 to 25 people. I tried to conclude their experiences, the resources that they use. So out of the 25 people that I talked to, around 15 to 17 people used MRCEM Success. And I also purchased MRCEM Success, and this is what I concluded, that it's a good question bank. Like these are MCQs with some really thorough and good explanation of basic sciences. So my belief is, if that you're going to use MRCEM Success, you won't need much of anything else. All I felt, like I'm going to break down each and every component of the exam. However, I felt that just in physiology, you might need to use BRS Physio for some topics, not all of it. So let's just get down into it. So first and foremost, let's do the mark distribution, right? So there are three main branches of this exam. Like about 144 questions are going to come from these branches. These are anatomy, physiology, and pharmacology. So let's just get into anatomy first. You're going to be getting 60 questions from anatomy. These questions, they're going to be clinicals based on basic sciences, and some are just going to be really just memorized questions from basic sciences. The major components would be upper limb, lower limb, abdomen, cranial nerves, brain, head and neck. So the major things that I came across that I thought were being tested in upper limb and lower limb would be the muscle functions, the nerves, what sort of innervation, which muscles they're innervating, what sort of deficits are you going to see if you have a nerve damage in the upper limb or the lower limb, what is the innervation of different muscles. In abdomen, there was more about relations, like what's the relationship of IVC to this part, what's the relationship of aorta. Then there was the cranial nerves, a lot of questions from the cranial nerve 3, cranial nerve 5, and then when you move on to the brain, this part was just really basic anatomy questions, not much detail in it, just a bit about, I feel that some clinicals from stroke were there regarding the artery distribution, and then it was head and neck. I personally found head and neck to be really difficult. However, in the exam, the questions that came, they were a lot similar to the ones in MRCEM Success. So 60 questions are going to be coming from anatomy. You have to do this component really well. The good thing is that I think there are around 1200 questions in MRCEM Success regarding anatomy. In the exam, the anatomy questions were a lot, I think the most similar to MRCEM Success questions, like the questions that were being tested. And out of the 1200 questions, if we talk about concepts, you would have to come around somewhere around 700 questions. Like after your first read, when you mark out some of the questions, you come to a bank of around 700 questions. So really do this thoroughly from MRCEM Success. It's going to be enough for anatomy. Coming on to physiology, this was really conceptual, not that difficult. I feel that MRCEM Success really covered it really well. All the basics regarding the insulin, regarding cardiac cycle. So it covers all the MCQs really well. However, I would like to emphasize here that the physiology questions in the exam, they would change certain components of it. So, but if you practice MRCEM Success really well, if you picked out the physiology concepts really well, you would be able to pick out those questions. So it won't be a problem for you. Just one thing is that for renal physiology, I felt that you should add BRS physio just to add a bit more depth to that knowledge. I personally found MRCEM Success, the questions and the explanations to be a bit deficit when it came to renal physiology. So that's again just my take. You might have really good core concepts of renal physiology and you might not need to do that. Coming on to pharmacology, you're going to have 24 questions from this branch as well in your actual exam. So in this, I just would love to emphasize that contraindications are very important. Like you cannot sit the MRCEM primary exam and expect to score well on pharmacology without going through the contraindications. Now, we are just going to take a small, pause here. Like if we go through the questions and these mark distribution, I've taken it from my own mark sheet. So, out of 180 questions, you're going to get 144 questions from these three components. And over the course of the last 5 years, the passing score for MRCEM primary has been somewhere in between 101 to 109. All right, so again, the passing score has been between somewhere 101 to 109. You're going to be getting 144 questions from these three components. Excuse me. So I personally feel that these three components are really important if you want to pass your exam. So you should do them a minimum of 3 times. Now when I say 3 times, I don't mean that you just do all the MCQs 3 times. Like after your first read, you're definitely going to take out some questions. You'll reduce the total amount of threshold of the questions. I believe if you do and cut out all the questions reduced for anatomy, physiology and pharmacology, it would be somewhere around the 1100 to 1200 MCQs. So I think it's very easy and doable. Like if you're even studying 2 hours, 2 hours and 30 minutes every day, you can do these 3 branches at least 3 times. So these are very important. Now coming on to the minors, you're going to have like about 9 questions of statistics, 9 questions from pathology, and around 17 questions from microbiology. Now, I did something which I'm not particularly proud of, but I'm going to share it with you guys. I did microbiology. I did it well. I had really good core knowledge from my medical school years because I studied microbiology really well. However, what I noticed was in the exam, in MRCEM Success, if you do take MRCEM Success or you take any other subscription, there is an option of recall questions. All right. So what I noticed during my exam that these questions, the questions from statistics, microbiology and pathology, they came from those recall sections. Like they were not changed. They were like memorized questions, like, touch and go questions. And I personally feel that these 3 branches, you shouldn't give them a lot of time. Like I understand whenever I'm giving advice to anyone, I tell them when you're preparing for an exam, it's not just about passing the exam. You should try to take as much knowledge from that exam as possible. So I'm going to, alter my statement a little bit. For the above three components, anatomy, physio, and pharmacology, try to extract as much from that as possible. Personally, I found pharmacology and physiology sections to be really, really fruitful. They added a lot in my clinical practice as well. But when it comes to these three sections, I'll say if you guys have time, really try to go into the details, really try to go through them. However, if you're someone who doesn't have time, like you're lacking on time, just, let it go. Just give it 10 days or maybe 12 days. Just go through the recall questions. So, after going through all of that, I just made a very 3-month sample plan. I think if you give it, you can do this, 25 days to anatomy, 25 days to physiology, 10 days to pharma, and then 15 days to these minor subjects. And then the last 15 days, just, really just, go through the recall questions, the section in MRCEM Success, or you can find these recall questions online as well. I understand GMC bans these recall questions and everything is there, but this data is on the internet. A lot of people are using it and you should use it as well. It's just study smart along with working hard as well. You cannot pass any exam without working hard. So this was my take on MRCEM primary exam. My golden tip is try to repeat the MCQs as many times as you can. Flag the questions that you're finding hard. Flag the questions that is a new concept to you. You haven't heard of it or learned it before. And just really repeat as many times as you can. And it's going to be really good for you. You guys will be able to pass the exam as well. End of the day, good luck. With any exam, you need a certain aspect of luck. And I just feel that before the exam, take your sleep, bring a snack to the exam, just relax and try to, whatever you've studied, just try to repeat it on that exam day, just try to convert it into good exam skills so that you can give the exam well. So if you have any questions, feel free to reach out to me. And I just remembered a few things, so I'll add them down as well. These two YouTube pages that I found while preparing for my MRCEM primary exam, I am going to add them here as well. So do check these pages out as well, because I found their content to be really good regarding MRCEM primary. So that's all from my side, guys. If you have any questions, leave a comment below. Do feel free to reach out to me, and I'll help you guys in any way I possibly can. Thank you.